Here.
Commissioner Colleen,
I'm here.
Chair Baker McCormick.
That's still
Here.
2 weeks.
You have a quorum present.
Next item, please.
B, Chairwoman's remarks.
Well, just want to say Happy New Year's to everybody. This is our first meeting of the year, and I am excited to get started. All right, next item.
C, approval of the December 6, 2022 meeting minutes.
Is there a motion for approval?
Support. Motion to approve.
It's been moved, and I guess Vice Chair, you support it. All right. All those in favor? Any opposed? Any abstentions? Motion passed. Thank you. Next item.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, communication from Dr. Seth, forwarding a report on how the funds were utilized and spent from the Michigan Department of Health and Human Services Local Stabilization Authority.
Great. Dr. Seth.
Chair Baker McCormick, Avni Sheth, the Health Officer and Medical Director of the Public Health Division under HHVS. This is in response to a request on the report of how funding was utilized under our MDHHS Local Community Stabilization Authority funding that we received. So the documents that were sent outlines the breakdown of how the funding was applied with this, the last fiscal year 22 compared to fiscal year 21. And again, this funding is meant to go towards local public health departments to supplement and defray the costs of providing essential local public health services. And so they are required to go towards these kind of mandated required services that we have to provide to our jurisdiction underneath the Michigan Public Health Code. And so we review those programs that are allowable under this funding and see where we can provide and supplement some of the funding that we do receive through our comprehensive agreement through the state, and where there's some gaps. And that's where this funding is applied to. So you'll see that a wide variety of programs under these essential local public health services were covered for this funding: food safety, HIV, STI control, communicable disease control, and our immunizations program.
Thank you. And how do we advertise to the public about these various services that we provide? Is there billboards or a marketing campaign that is put out? Mm-hmm.
Yeah, so it depends on the program. There are different communication channels depending on the program. And so, our website is often used to be that public-facing source of information for these various programs, and what is the right way to contact and access these services. For these essential local public health services, many of these activities are in response to cases we received from the state, individuals who need follow-up for various communicable disease, or there's an outbreak that we're responding to. And then we reach out to various community organizations that we work with to partner to provide these services. Our food safety program has as an example, a website where the public is aware and business owners are aware who to contact for various different inspections and services.
I would be interested in just seeing what that looks like, the advertisements or brochures. I just don't recall that I have seen any communication or heard of any. So if I can, or if you can, just send me whatever you have.
Sure.
So that I can then share it with, and other commissioners can share that information with their constituents. That would be great. Any questions from commissioners? Commissioner Vice Chair Colleen?
Thank you, Madam Chair. Trying to figure out, do the mics work at all?
I believe they are working.
Light does. that
There's
sounds
no
like
light,
it.
but it's working.
Okay.
Mhm.
Good afternoon.
Hi.
The source of these funds, this is not the 10, 12 million that we get annually from the state where we put it in various categories. What is the source of the funds for essential local public health services from Lansing?
are popped up here right away, but yes, you're correct. It's in addition and not the same source of funding as our comprehensive agreement. He'll go into that a bit more.
Yes, and also in the Michigan Constitution, there are stabilization funds that go to local municipalities and counties. This is
I'm
not
sorry,
that-
can you give your name and title
Sure.
for the record, please?
T.R.
Thank you.
Winter, lead attorney for Wayne County Corporation Council. And in the Michigan Constitution, there is stabilization funding that goes to local governments. Around 2015, there was an additional law passed about this kind of stabilization funding where some of it goes to local governments, but then in that legislation, it stated that in about, I think it was either 2018 or 19, there were set aside funds that would go strictly to local health departments to support the 8 mandated services under the Public Health Code. So right before COVID, we got the first payment. It was a paper check that came in the mail from the state, and that's where this money goes. It is dedicated by statute to the local health department's mandated services.
We've only had 2 years of this funding,
2 or 3, yes.
and it's not part of revenue sharing. It's a separate,
Correct, yes.
if the
it's a-
state is still doing.
It's a
revenue.
set aside that comes, I think it was designed to help meet the 8 mandated services in the Public Health Code because there are maintenance of effort requirements that the state does not really fully fund going back to the 90s. So this is some way to help the state be able to support us to do the mandated services without dedicating it in the budget directly.
As I noted that the numbers were the same year over year, 705 and some change. Is that what we anticipate every year, 705,000?
I believe the last time this came up a few months ago, we researched that and the Board of Stabilization or whatever in the state has some ability to change and review the amounts, but we have not gotten anything that leads us to believe
They
they'll
decide
change
up
it.
there, okay.
Yes.
The other question I have on this, it was commented that these dollars can be spent on approved public health services. I don't think that was the phrase,
Essential local public health services.
essential.
Mhm.
Is this the complete list of essential local public health services that we could apply it to?
This is not the complete list. Hearing and Vision is also is a program that is one that that we did not apply these funds towards, but is one of the programs that is approved for this funding.
How about lead abatement?
Lead is not included.
Lead is not included. That's just crying out for more funding. We got lead homes all over the county. What is STI control? That's one of your categories.
Sexually transmitted infections.
Okay.
Mhm.
That's been an effort, General. Okay, yeah, it's a shame we can't, at least in my opinion, do something about lead funding. Because that's just brutal what's going on out there. All righty, thank you for the information. Thank you, Madam Chair.
Any other questions from commissioners? All right, well, thank you so much. Is there a motion for approval? Or receiving? Yes. This is a report to receive and file. Yes, thank you. And it's been moved and supported. All those in favor?
Aye.
Any opposed? Any abstentions? Motion passed. Thank you. Next item.
Item 2, communication from the Department of Health, Human and Veteran Services forwarding the Medical Examiner's Office turnaround time analysis from October 1st, 2022 through November 30th, 2022.
Okay, is there anyone from the department to talk to this?
Afternoon, Chair Baker McCormick and everyone. My name is Kim Holmes Beauvais. Health, Human, and Veteran Services Contract Specialist for the Medical Examiner's Office.
All right, so you provided a report for the MEO's office, and it's timely because we wanted to continue to get and receive updates on what was going on in the ME's office. And it looks like everything is kind of moving along. Although in the report, it did not indicate if there were any outstanding requests for death certificates or cremation. Do you know if there are any? It talks about the number that has been completed, but do you know if there's any outstanding issues with providing those to anyone currently?
Present time, there are no complaints.
Okay. All right. Any questions about the report or? Yes, Vice Chair Commissioner Colleen.
I think it's on. No? Yeah.
Mhm.
Good afternoon.
Good afternoon.
We've had some conversations at this table regarding reporting with the new management of the MEO's office. So we get this one today, but I'm also trying to understand expectations here. There are certainly other aspects that this commission is interested in terms of the operation of the MEO's office that are not reported here, that are reported, well, not yet, but, looking to set up some reporting. And also there's, again, some things on here that I just don't understand what they mean. Like a TAT, a final COD, cause of death, TAT. Use TAT, average TAT for cremation permits. The heck is TAT?
Burn with the cremation permit under there, to be specific.
Also under final cause of death and amendments, there's the final cause of death TAT and the amended TAT. I just don't know what I'm looking at here.
If you like, I can have Director Jordan send you.
Sorry?
If you would like, I can have Director Jordan send you documentation to explain all the definitions if you like to help clarify information.
Yeah, because I don't need, you guys know your own shorthand within your own shop. I don't necessarily know your shorthand.
And just to let you know, TAT is turnaround time. If
Okay,
that helps.
that's what I
If that-
needed.
if
That's
that
what I
helps.
needed to know.
Great.
So it's good to see turnaround time on the cremation permits. I haven't done all of the math on here, but it's and within a half hour, if it's a 0.0003 days to get back. And that's quick and that's good, And I'm hoping we hear from the funeral homes that they're like, oh yeah, this is great. Do you have a schedule of what you're going to report to the commission when and what topics you're going to report?
I can make sure that Director Jordan will follow up with that.
I would love to discuss with the department and with my colleagues in terms of reporting. Do we want to see report every 6 months? Do we want a quarterly? Do we want an annual? What do we want included in that? Because, there's been, issues with the MEO's office for some time now. And so I think for the commission to stay on top of this, we need to get reported to in the appropriate amount of time, and we haven't established that. And in appropriate categories. So are you in a position today to discuss what the intention of the department is in terms of reporting to this commission?
I would like to defer that to Director Jordan.
Sorry?
I would like to defer that to Director Jordan. She can clarify for you.
All right, well, I guess that's who to talk to then for me also. Okay.
And also for the record, I see that Dr. El Sayed is here today. He is the new incoming director, so we'll have those questions for him as well
Yeah.
to clarify
And
for
I
us.
intended on that as well. I just
Yeah.
didn't know the exact
Right.
time where
I would be
seat comes
interested in
open
that.
and
too.
somebody else fills it. I don't know the exact time on that.
Right.
So,
So
but
since he's
that's okay.
here.
Yeah, yeah.
he-
Well, I knew, and I'm glad he heard my questions on
Question.
this, so he knows what's coming down the pike for me.
Exactly. Yes.
All righty, thank you so much. Thank you, Madam Chair.
Mhm. Thank you. Thank you so much. Any other okay, Commissioner Marecki.
Thank you, Madam Chair. So besides this report, is everything going out all right over there?
Yes, things are going along just fine.
No concerns?
No, it's ever going. We're trying to improve. As you see, the numbers have drastically been improved. So things are going very well. I'm smiling.
That's good. All right, thank you.
Yes, Commissioner Colleen.
Yeah, thank you, Madam Chair, for recognizing me again. One I forgot, do we have an official stamped MEO yet? Somebody that sits in that chair as the medical examiner?
Right now, we have an intern medical director,
Yeah, that's what I thought. And
Dr. Lukman Sung, who was already one of the doctors there. He is the intern, but no one has been identified as of yet.
interim,
Yes,
and there's a process underway for a permanent?
yes.
All right. Thank you, Madam Chair.
Thank you. Any other questions? All right, thank you so much.
Thank you, Madam Chair.
Mhm. All right, is there a motion to receive and file this report? It's been moved and supported. All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? Motion passed. Next item.
Moving to item 3 on the addenda, requesting commission approval of Amendment 6 to a 5-year professional services contract with a 1-year option to renew with Assured Family Services.
Good afternoon, Madam Chair. Melissa Fernandez, Division Director for Juvenile and Youth Services for HHVS. We are requesting the approval to exercise a 1-year option with our Assured Family Services contract and to add funding to the provision of child welfare services so that we can continue to provide the assessments, mental health and substance abuse screening that's completed by AFS for all of our juvenile involved youth.
In the report, it indicates the various providers. And I didn't see that it indicated how many youth that we serviced or serviced during the year. Do you have that information?
I can get that. What I do have is that we are projected to serve 888 child welfare youth and 712 juvenile justice youth. So that should be on par to what we did serve, but I can get the accurate numbers to the commission.
Okay. And as far as what we pay to our providers, is it per appointment?
Correct.
And then we would get any funds back? Is that how that works?
That's correct. So it's per
Okay.
unit and an assessment might be one charge, a session might be another charge. There's a whole list of charges depending on the service and the unit that they receive.
And was there an increase of the number of juvenile or youth that came through the programs? Do you know?
I would have to get that number for you.
Okay. All right, if you can email that to
Absolutely.
me, that would be great. Any questions from commissioners? The other question, or maybe clarification, some of the providers, I was just wondering, do they provide a report to you, and how often does that report?
Yes, so they provide a report to AFS and AFS provides the report to us. We're currently compiling our annual report, which will
Okay.
show you the data, the deep dive data with all of these providers, and that report will be to you in March.
Okay, in March. All right. Any questions from commissioners? Thank you very much.
Thank you.
Madam Chair, I'd like to move this item for approval.
Thank you.
Support.
Been moved and supported. Roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Baydun,
Yes.
Commissioner Anderson,
Yes.
Commissioner Khalil,
Yes.
Chair Baker McCormick.
Yes. Motion passed. Next item.
F, such other matters as may be properly submitted before the committee.
And there are none. Oh, yes, go right ahead.
Could I just make a comment?
Sure.
And this is from a news article today, yesterday and today, that is somewhat concerning to me. It's reporting that Wayne County, the Health Division is now encouraging masks for our students in Wayne County. It's not a mandate, but they're encouraging it. And more for like RSV and the flu and possible COVID variants coming up in the future. I am just hoping this does not go into a mandate and these decisions are left to the schools themselves, who will listen to the parents themselves. We never did masking before COVID, and now I'm seeing this, and this isn't just in Wayne County. Ann Arbor schools are doing it for RSV and the flu. I mean, we could literally, if this keeps going, schools could be masking year round forever. I mean, we always have had the flu. The RSV is higher today, but higher, not today, but higher this season because all of us have been locked down and masked up for 2 years. So I just want to give my opinion on that. I just hope this does not turn into school mandates with masks again. Thank you.
Thank you. Any other commissioners? All right. Next item, please.
Public comments.
Anyone in the audience? Anyone on Zoom or by phone? Would you like to make a public comment? Madam Clerk, any emails or Zoom?
There are no emails, but there is a hand raised. Pres D Buffington on Zoom has a hand raised.
Go right ahead, President Buffington.
I just wanted to congratulate you all for having your new term sworn in and present. And my congratulations goes out to the whole commission.
Thank you. Any other comments? There are no other emails, correct?
Correct.
All right, next item, please.
Adjournment.
Your motion,
So
So
moved.
moved.
meeting adjourned. Thank you.